Welcome to this module of musculoskeletal assessment. Here we examine the ankle and foot. The ankle is comprised of the talocalcaneal joint, which is a diarthrosis, a ganglimus, and a hinge joint, and the tarsometatarsal joint, which is a diarthrosis, arthrodia, gliding joint. As with all of our modules, we begin with hipirone, and in considering the history, OPQRSTUV. We ask, what is the onset of this ankle or foot pain? How did it begin? What makes it better? What makes it worse? What is the quality of the pain? Is it burning, aching, throbbing, stabbing, crushing? Does this pain radiate to or from another site? What specific site is the pain? What is the timing of the pain? Is it worse in the morning, at night, after a certain activity? Is there an underlying motive for your patient presenting with ankle pain? And of course, it's important to get vital signs: temperature, pulse, respiration, height, weight, and blood pressure. As in every module in our differential diagnosis of joint problems, we use the mnemonic RABBIT-MEN. We want to make a determination if this is referred pain. Is it an arthritis? Is it bone pain? Is it pain from a bursa, a bursitis? Is it tendinous? Is it muscle pain? Is this an effusion? Or could it be nerve pain? In our inspection, we look for swelling, for deformities. We want to make sure that we count the toes. We look at the wear on shoes. This will give us an indication of how the client walks. In our palpation, we palpate several landmarks. The first metatarsophalangeal joint, the first cuneiform, the medial malleolus, the head of the talus, laterally the fifth metatarsophalangeal joint, the fifth metatarsal head, the cuboid, the calcaneus, and the lateral malleolus. Posteriorly, we want to palpate the dome of the talus. Inferiorly, the metatarsal heads and the calcaneus. The calcaneus navicular ligament, or the spring ligament, the tibialis posterior tendon, the deltoid ligament, the long saphenous vein as it comes through the ankle, There's a mnemonic that teaches us the order of things as far as soft tissue palpation is concerned. The mnemonic is Tom, Dick, and Harry, medially to the posterior aspect of the foot. First, you have tibialis posterior tendon, then flexor digitorum longus tendon, then the posterior tibial artery, and then the tibial nerve, and finally flexor hallucis longus tendon, which travels on the shelf of sustentaculum tali. So here's your mnemonic, Tom, Dick, and Harry. Laterally, we palpate the lateral collateral ligaments, which consist of the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. We also palpate the peroneus longus and brevis tendons laterally. On the dorsum, from medial to lateral, we have tibialis anterior tendon, extensor hallucis longus tendon, the dorsalis pedis artery, and extensor digitorum longus tendon. We only percuss if a fracture is suspected, and we want to look for incidental, fortuitous, or chance findings, for example, a Morton's neuroma. Checking range of motion, dorsiflexion at the ankle is 20 degrees normally, plantar flexion 45 degrees, inversion at the subtalar joint is 10 to 30 degrees, and eversion is 5 to 20 degrees. Our orthopedic exam consists of this mnemonic, dash. The 100-yard dash, we use our foot and ankle, so we come up with this mnemonic dash. The D stands for dorsiflexion. Take a moment, review this slide, and then practice this exam on a partner. The A is for the Achilles continuity test, or Simon's test. The S is for the stability test, also called the anterior draw test. And the talar tilt test is another stability test. And finally, Homan's test. Our neurological exam, L4. The deep peroneal is responsible for dorsiflexion through the tibialis anterior and extensor hallucis longus through L5. Pause the presentation, take a moment to review this slide. Plant reflection is accomplished by the peroneus muscles through the superior peroneal nerve S1 and gastrocnemius through the tibial nerve. Inversion is accomplished by tibialis anterior, L4, and eversion by the peroneus muscles through S1. We also want to examine related areas, specifically the knee and the lumbar spine. This is the end of the ankle and foot assessment.